What's going on today?
My chest is so tight and I can't breathe, and I just feel like I can't get any air into my lungs or anything.
You think you should go to the doctor and see if you have asthma or something?
Yeah, maybe.
Hello, what brings you in today?
Well, I've been having some breathing issues recently, like when I'm running, and then whenever I do anything strenuous throughout the day, it just feels like I can't get any oxygen into my chest, and I almost can't breathe for a few minutes at a time.
Have you ever been diagnosed with asthma by chance?
No, I haven't.
So it sounds like you might have asthma, so we're going to put you on this drug called Beclomethasone. The actions are to prevent inflammation, suppress airway mucus production, and promote responsiveness of beta-2 receptors in the bronchial tree. It's used to reduce the airway mucosa edema. The use of glucocorticoids does not provide immediate effects, but rather promotes decreased frequency and severity of exacerbations and acute attacks. Inhaled agents are used for long-term prophylaxis of asthma and is also used to promote lung maturity and decrease respiratory distress in fetuses at risk for preterm birth.
Are there any complications involved with this medication? It sounds good so far.
There are a couple complications, which are difficulty speaking, hoarseness, and candidiasis. So I'll advise you to rinse or gargle with water after using this. And if you develop redness, sores, or white patches, you will need to report this to your provider immediately.
Okay. Are there any precautions I should be aware of when I take this medication?
This is a pregnancy risk category C drug. It is contraindicated in clients who have received a live virus vaccine and those who have systemic fungal infections. You should also use cautiously in children and in clients who have diabetes mellitus, hypertension, heart failure, peptic ulcer disease, osteoporosis, and or kidney dysfunction.
All right, well, I don't think I have any of those. Are there any foods or other medications I should be aware of while taking this med?
There are no known interactions with this medication, but if you do start taking new medication, I would notify your provider just in case.
Okay, is there anything else I need to know about this drug?
You will need to use this on a regular fixed schedule for long-term therapy of asthma. It's not used to treat an acute episode, but kind of to prevent it from happening. You will administer using an MDI device, DPI, or nebulizer. If you are prescribed an inhaled beta-2 agonist and an inhaled glucocorticoid, you will need to inhale the beta-2 agonist before inhaling the glucocorticoid because the beta-2 agonist promotes bronchodilation and enhances absorption of the glucocorticoid. Get in the zone with Beclomethasone.